Seronegative spondyloarthropathies. Why these spondyloarthropathies or seronegative arthropathies? Why they are called seronegative? Because rheumatoid factor is usually inactive in spondyloarthropathy. That's why these conditions they are called as seronegative spondyloarthropathy. What are the examples of seronegative spondyloarthropathy? Psoriatic arthritis, ankylosing spondylitis, IBD associated arthritis, Ritter syndrome, and Behcet's disease. These are some examples of seronegative spondyloarthropathy, which you can remember from this mnemonic, that is pair B. P for psoriatic arthritis, A for ankylosing spondylitis, I for IBD associated arthritis, R for Ritter syndrome, and Behcet disease. We'll discuss psoriatic arthritis in along with psoriasis and dermatology chapter, and the remaining causes we'll discuss here. So the first example of seronegative spondyloarthropathy is Behcet disease. It is a vasculitis that is characterized by a triple symptom complex of manifestation of Behcet disease, usually a clinical trials of symptoms such as recurrent oral ulcers, recurrent genital ulcers, and anterior or posterior uveitis. These triad of clinical symptoms, if this is present, then the diagnosis will be Behcet disease. The diagnosis of Behcet disease is based on clinical criteria, that is these clinical triad of these symptoms should be present to make a diagnosis of Behcet disease. Specific diagnostic tests are lacking for this condition, and the treatment is topical steroids. And Behcet disease can sometimes be associated with lethargy, that is exaggerated skin injury after minor trauma. So this is an additional clinical feature that you need to remember for Behcet disease. Next example of seronegative spondyloarthropathy is ankylosing spondylitis. Ankylosing spondylitis, back pain and morning stiffness. It is a genetic condition that is strongly associated with HLA-B27, but we cannot use this HLA-B27 for the diagnosis because it is positive in 10% of the normal people. So what is ankylosing spondylitis? Back pain and morning stiffness that improves with physical activity and not with the rest. Remember, back pain due to sciatica, it improves with the rest, while the pain in ankylosing spondylitis, it improves with physical activity. And because it is an inflammation of sacroiliac joint, due to inflammation in the sacroiliac joint, this back pain and morning stiffness occur. So there will be tenderness of sacroiliac joint. Anterior uveitis can also be present. ESR will be high and WBC may also be high because it is an inflammatory condition. So WBC and ESR can be high. And ankylosing spondylitis, the name of ankylosing spondylitis, it starts from A and it is associated with two A's. One is anterior uveitis and one is aortic regurgitation. The diagnosis of ankylosing spondylitis is confirmed on X-ray of the sacroiliac joint, and X-ray of the sacroiliac joint will show widening of joint spaces. Sometimes a test that is known as Schober's test that is done to make a diagnosis of ankylosing spondylitis. How Schober's test is done? A line is drawn 10 centimeter above and 5 centimeter below the back dimples. So the dimple that is present in the gluteal cleft, just above the gluteal cleft, a line is drawn 10 centimeter above this dimple and 5 centimeter below this dimple, which is also known as dimple of Venus. Then the distance between two lines is, the patient is asked to bend and the distance between two lines is measured. If the distance between two lines, normally the distance between these two lines should be increased by more than 5 centimeter when the patient is asked to bend as forward as possible. But if this distance does not increase on bending of the patient, then diagnosis of ankylosing spondylitis will be suspected. Treatment of ankylosing spondylitis include physiotherapy, NSAIDs, and if it does not respond to NSAIDs, then oral corticosteroids and anti-TNF therapy such as etanercept and adalimumab can be used in severe cases. This is an example of Schober's test. Complication of ankylosing spondylitis is fusion of the spine, that is also known as bamboo spine. So Behcet disease and ankylosing spondylitis. Now the third example of seronegative spondyloarthropathy is reactive arthritis. Now reactive arthritis is also a seronegative spondyloarthritis. Remember these three symptoms, this triad of symptoms, that is migratory oligoarthritis of lower limb. What is migratory oligoarthritis? Migratory means the pain first start in the one joint and then it gets better in that joint and then start in the other joint. The pain migrate from one joint to another joint, or the arthritis migrate from one joint to the other joint. So migratory polyarthritis plus back pain plus extra articular features such as uveitis. Typically, there is no fever. It is seen in young adult, in sexually active young adult, and reactive arthritis usually follows after a urogenital infection, GI infection. Urogenital infection that can lead to reactive arthritis. They include sexually transmitted infections. GI infections such as dysentery can also lead to reactive arthritis. So if someone after a history of sexually transmitted infection or dysentery develops migratory polyarthritis, back pain, and uveitis or conjunctivitis, then you will suspect reactive arthritis. Remember Ritter's triad. Ritter triad to make a diagnosis of Ritter arthritis or reactive arthritis. What is Ritter's triad? Conjunctivitis, urethritis, and arthritis. Cannot see, cannot pee, cannot climb a tree. Due to conjunctivitis or uveitis, because there's involvement of the eye, so cannot see. Due to genital infections, STI, there will be urethritis, so the patient will have difficulty in peeing. And due to joint pain, he will have a difficulty in climbing a tree. So this mnemonic is helpful to remember uh, reactive arthritis, that is cannot see, cannot pee, cannot climb a tree. And usually there's a skin rash as well, along with these signs and symptoms. The management is simple: analgesia, NSAIDs, or intra-articular steroids. For joint pain, sulfasalazine and methotrexate are sometimes used for persistent disease. Symptoms rarely last more than 12 months and they resolve usually within 1 year. But if the disease persists beyond 1 year, then we can use sulfasalazine and methotrexate. Reactive arthritis is also known as Ritter syndrome. It usually presents with 2 to 4 weeks after a genitourinary or dysentery. So Ritter syndrome, ankylosing spondylitis, and Behcet disease, they are all examples of seronegative spondyloarthropathies. Psoriatic arthritis we'll discuss in dermatology chapter along with psoriasis. And the fifth example of seronegative spondyloarthropathy is IBD associated arthritis that we have already discussed in GIT chapters.
So this Ritter syndrome and Ritter triads, they are both the same.
Yes, if Ritter triad is present, uh, then we'll call it as Ritter syndrome or reactive arthritis. They are the same name of a same disease. Ritter syndrome, Ritter triad, reactive arthritis.
Right.
Ritter syndrome is basically the name of the disease, and Ritter triad is a triad of these three
Three,
symptoms:
four things.
conjunctivitis, urethritis, and arthritis. So this was all about seronegative spondyloarthropathies. Now, our next topic is